back. This is Boomer Life on CIL 650.
Home, where my thoughts escaping. Home, where my music's playing. Home, where my love...
And welcome back. This is Boomer Life on CIL 650. I'm Joanne Sutton. Thanks for joining us today. We're speaking with our friends today from Home Care Assistance. It's a company of dedicated individuals committed to changing the way that we age. And I'm joined in studio now by Dr. Marilyn Kyriasis, along with our additional guests and experts. We have Dr. Paul Sugar with us and Whitney McMillan from Home Care Assistance. So Marilyn co-founded the Paul Sugar Palliative Support Foundation and Palliative Support Center. She is also a clinical pharmacist. Along with Paul, their vision was to have a place for people to go. And I think I'd best let Dr. Kyriasis explain the rest of that vision.
Thanks, Joanne.
Thanks for being here.
So the Paul Sugar Palliative Support Foundation was founded in 2013. And it provides support to those living with advancing serious illness, as well as to their family and caregivers. Our primary goal is to provide emotional support to help relieve suffering and to deal with fear and loneliness during illness, death, loss, and grief. We have a palliative support center on the North Shore. And that, I guess, we see that almost as a community center where people going through a serious illness and their families are welcome to come in for a cup of tea or coffee, cookies, have a chat. We find out what their needs are. We provide, the center has been designed to provide non-medical supports. So once we've identified their needs, we can help them put those supports in place and deal with anything that needs to be dealt with at that time.
So you talk about non-medical support. So are you trying to determine their medical needs as well? Do you work with their doctors? I mean, I'm just trying to get a vision of how it all works.
So I'll give you an example. Say somebody has been diagnosed with a terminal illness. They get the information from their doctor and then they go home. So then they're at home and they think, what now? Where do I go from now? What do I need to know? So they can come into the center. The first question we ask them is, do you have a medical team in place? And if they do, that's great. If not, we try to find one for them. We let them know what's in place for them in terms of supports, in terms of provincial supports as well as local supports, and make sure they have any forms that need to be filled in place. And we let them know what the criteria are, how they're eligible for them. We help them with that process.
Would you actually help them fill out the forms?
Yes, we can help them with those forms. Then we find out what other needs and what other supports they need to have in place. And those needs change throughout the illness. So, and it depends on the needs that they have at the point in time. And it also depends on what other supports they have in place. Many of the people we see are on their own without any family at all.
No siblings, no parents.
No siblings, no parents, no kids, completely on their own. So for those, we have a greater support system in place for them. Their needs can vary from getting meals in place, from transportation to and from medical appointments, or emotional needs, financial needs. We make sure that they have their legal affairs in order, financial affairs in order. We ask them all these questions. We help navigate them through the healthcare system. We provide guidance and helping them with where they are at that point in time and with future plans. And basically, it's really just a matter of identifying what they need and individualizing the support to help them with their individual needs.
And I think Dr. Sugar explained it's you find out what their needs are through them, not through anybody else.
No.
Yeah.
So it's not our needs, it's their needs.
Their needs through communication.
Through communication.
Series of questions, hand-holding. I imagine there's a lot of tears in your job.
There's a lot of tears.
There's a lot of tears, a lot of laughter.
Lots of hugs, lots of compassion.
A lot of hand-holding. And it does sound like the Paul Sugar Palliative Support Foundation is run by angels. You have a lot. You do a lot, it seems. How do you put together a proper support team to deal with this? There is a lot of work that you have to do for each individual person because, of course, all their needs are different, as Dr. Sugar was explaining earlier.
So we're an independent organization, and we're mainly run by volunteers.
Okay.
So we have a group of volunteers that we train. If some of the needs are needs where we can tap into other resources in the local community. We do that and we make referrals. If not, we do support them through our own organization. We do have volunteers that are there to provide one-on-one support. So we attach a volunteer to a patient, and that volunteer is with them throughout the journey. So there's consistent care. Consistent care at home. The volunteer will follow them into the hospital or the hospice or to the cancer agency, whatever the need is. And the volunteers, again, provide whatever support needs to be provided. So taking them to and from medical appointments, help with grocery shopping. Companionship is a big one. Just spending time with them, listening to them, helping sometimes with family issues, family dynamics. So whatever the need is at that point.
I'm just wondering, how does somebody find you? Do you work closely with general practitioners or with other agencies or charitable organizations to help educate people that this foundation actually exists? I'd never even heard of it before.
Well, we do work closely with the hospital. We get a lot of our referrals from the chemotherapy clinic. We get referrals from doctors and community nurses and private nursing companies. We also get referrals from the community, from friends and neighbors. There isn't a formal referral structure in place, so people can just come into a center and get the help they need. And all our services are confidential and free. And so they can just come through our doors and get whatever they need.
And how are you funded?
We are funded by the community through individual community donations. We are not affiliated with the hospital. We don't get any hospital resources, funding resources, and nothing from the government either. We're independent and community funded, community run, and there to support the community. And
no public fundraisers or?
Well, we do our own fundraising.
Oh, you do? Okay.
We do our own fundraising, and the community has been very supportive of us.
That's wonderful. So, when a patient gets a diagnosis of a terminal illness or disease, is that when they come to you, or do they come to you when they actually get closer to the end of their road?
They can come to us at any point in time, whenever they're ready to come. Ideally, we'd like to see them at diagnosis, so that we have more time to spend with them and be able to help them more that way. For the ones that haven't heard about us and are kind of right near their end and immobile, not able to come and see us, we do go and see them at home. So we do house calls and go and see them. But ideally, the more time we have with patients and their families, the more help we can provide.
And where do you fit into the picture when there are other caregivers involved, like other family members or professional caregivers? How do you work collectively?
So we don't duplicate any of the resources. We actually complement and integrate with existing resources. We work together with physicians and community nurses and home support. All of our programs and volunteer services are free. So for those that have a financial need and can't afford private home care, then our volunteers would have more volunteers attached to them to provide more supports. But in essence, our volunteers would not necessarily do personal care. We don't have any professional nurses that would do nursing care. We do have a lot of volunteers with a nursing background, but they won't do nursing care or personal care. But they're there mainly
like helping with bodily functions, yes, or showering or things like that. Mm-hmm. Okay.
They're mainly there for emotional support and somebody to talk to, and a consistent individual that is with them throughout the journey.
Do you find that's one of the biggest gaps, is people really need to talk about their illness or their journey? Or
people really need to talk to somebody. Sometimes family members are there to listen to them, but often people want to talk about things that they don't want to talk about to family members.
Mm-hmm. This would be one of your biggest challenges.
Yes.
Or their biggest challenges, yes.
They have things to...
It's easier to talk to a stranger.
It's easier to talk to a stranger. They don't want to talk to a family member for fear of hurting them, or don't want to talk about the upcoming death or whatever. So they feel more comfortable talking and releasing what they have with the stranger.
How did your position as a clinical pharmacist ever prepare you for a position like this with a palliative care foundation?
I've been dealing with patients and their families for the last 25 years through through my work as a pharmacist. And I have spent most of my time dealing with physical pain, and I still do pain management and help people with their the pain management in terms of physical pain. But there's a lot of emotional pain involved with palliative care, with life, with death, with suffering. And so now I've expanded to looking after emotional pain as well as the physical pain.
Well, I think I can hear the passion in your voice. I think you were born with that empathy, and it's just married perfectly with your pharmaceutical background as well. This is Boomer Life on CL 650. I'm joined in studio with clinical pharmacist Dr. Marileen Kyriasis, and she is from the Palliative Support Foundation, along with Dr. Paul Sugar, and Whitney McMillan is a senior caseworker with Home Care Assistance. Our conversation today is all about palliative care, truths, myths, facts, fears, you name it. All of our guests will join the conversation next on Boomer Life on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.